A lot of parents don't know exactly what to think about their sons using cannabis, smoking, vaping, gummies. Surely it's better than booze, right? All right, it's legal for adults. Can it really be that bad for a teen boy? Here's the data from the National Institute on Drug Abuse when it comes to usage. Teen boys today are a lot less likely to drink as high school seniors than they were to be drinking in the year 2000. But the same cannot be said of cannabis. Usage has declined somewhat, that's true, but THC potency when they use it has quadrupled, according to NIH. The agency runs a study every year. It's called Monitoring the Future. You can check it out. It's on the University of Michigan website. And it warns, quote, heavy cannabis use in adolescence is associated with negative effects on working memory, processing speed, verbal memory, and academic functioning. Oh, and then there are all the reports about psychosis in young men, especially if you start young. So, how young is too young? How much is too much? Dr. Grace Blest-Hopley earned a Ph.D. in Neuroscience at King's College. She has published several papers on the effects of THC on adolescent brains. And now she's the Chief Scientific Officer of NWPharma Tech, running clinical trials using non-THC cannabinoids to treat patients who are clinically high risk for the development of psychosis. Grace, so nice to see you. Welcome to All Boy.
Hi, Chance. Lovely to be here.
You are doing some really interesting work globally on cannabis and alternatives, but I want to begin with the cannabis, I guess, old-fashioned THC that most people are familiar with. And I came to your work through this paper called Is the Adolescent Brain at Greater Vulnerability to the Effects of Cannabis? A Narrative Review of the Evidence. It's from 2020, Frontiers in Psychiatry, and seems like, if I'm getting it correctly, adolescent brain, greater vulnerability, broadly speaking, yes, it is.
Well, yes, because when we are going through adolescence, there are very significant changes that are taking place in our brain. Obviously, when we are first born and we are infants and children, our brain goes through a real process of growth. So everything in our environment and around us is a stimuli that helps to grow neuronal tissue and different connections within our brain that help us to learn what the environment around us is and does so that we can react to it. Now, once we shift over into adolescence, that process of just neuronal growth, of just brain growth, actually stops and we go through what is a process of pruning. So essentially what happens is we go through this sort of brain matter, and what our brain does is it very systematically works out which connections we need, which systems we need to strengthen, and it allows our brains to become much more efficient and better, therefore, at responding to our environment in a suitable way. And that process can really take place from the start of adolescence. So we're talking, 11, 12, 13 years old, right up until actually our mid-20s, we're now realizing. It's not until about the age of 25 that we are somewhat cooked, as it were, in terms of our neuronal tissue. So we do have this huge period during which we're going through a very distinct period of neurodevelopment.
I see that pruning. I have young children, and I remember when they were very young and people would say, talk to them in any language, tell them anything. At that point, their brain is making all of these connections. Then later on, we'll decide, what do I not need to know? Again, let's optimize this and make things work quicker. And so the pruning begins at the beginning of adolescence, right?
Yes, that's right.
You say in your paper, adolescents cannabis users show altered functional connectivity within known functional circuits. Doesn't sound good. What does that mean?
So effectively, when we have this period of neuronal pruning during adolescence, there's something that is controlling it. There's something that is deciding what we're going to keep and what we're not going to keep. Now, a lot of that is external stimuli. It's, going and continuing with maths class, and so your brain is like, okay, we're going to need the part of our brain that's good at maths and all the rest.
Unfortunately, of it. Yes.
Well, unless you're me and you're still doing the maths, eh? But what also is really important in this are these regulatory systems within our bodies. Now, one of the probably most important ones in this process is something called the endocannabinoid system. Now, the plant named the system. So we found out about the cannabis plant and that the consumption of cannabis had these psychotropic effects. And then we found the receptors and the system that those receptors belong to, and we named it the endocannabinoid system. Now, what this system does is it essentially acts as a kind of gating mechanism at the receptors that allows us, when we're going through this pruning system, to basically have a bit more of a handle on what neurons we still need and which ones we don't. Now, to come to that statement and that finding from that paper, what you might initially see is more activation in the brain in cannabis users. And this paper, I took evidence from a wide range of studies that had been conducted in adolescents and in adults. But those who had started in adolescence seemed to have what was an increase in activation. But actually what it is an inefficiency. What we want is to get to the right answer in the least amount of effort, the least amount of activation. And in adolescent cannabis users, who are now largely, they were in adulthood at this point, that we were looking at their brains and their brain functioning, is more activation because the pruning was not done in a way that allowed for the most efficient retrieval of, say, information. Now, that might not really mean anything, and it might not be very important when we're thinking about some of the simple memory tasks that we often do when we're doing neuroimaging studies like the ones that I was doing in my Ph.D. But once we start to get up the cognitive load and we start to ask for, more of a demand of our brain in order to either encode memories or recall memories, that's when that inefficiency is going to become a problem, because you're going to hit the ceiling in terms of the amount of effort that your brain can put in at an earlier rate than those who have more efficient systems.
Can you say more about what, let's say a 15-year-old takes a gummy or vapes or whatever. What is THC doing in the brain? Because you've done fMRIs to see in real time what's happening. What is the effect in the brain?
So what happens when you consume THC on an acute level is that it passes through the blood-brain barrier. THC, tetrahydrocannabidiol, goes into the brain, and it binds to a specific receptor in the endocannabinoid system called the CB1 receptor. We're not very imaginative with these things. The cannabinoid receptor 1. And the cannabinoid receptor 1 is located on the synapses, so between two neurons that are passing a messenger from one and to the other. Now, what the THC actually does is it acts as a gate. So it hires the threshold that the activation needs to reach in order for the message to be passed to the next neuron. So essentially, it works as an inhibitor of activation. Now,
that's weird that your brain is more activated and lighting up, but it's also inhibiting it in some ways.
So when I was speaking earlier about the larger amounts of activation, that is from chronic use. So that's what we're seeing in terms of what would be then structural changes and functional changes that have happened to the brain. When we talk about acute activation of THC, that is the THC being present at that time, binding to the CB1 receptor and inhibiting the activation from happening from one place to another. Now, it's important for us to remember as well, the brain is a very complicated thing, and not all activations are causing a positive activation on the other side. And we have neurons that are based, a lot in our limbic system, the memory centers of our brain, that have inhibitory action. So sometimes we inhibit the inhibitor. So THC goes in, inhibits an inhibitory action, and then we get activation that we didn't want to happen, that would have normally have been stopped because of the presence of THC. So it's not always a very linear story in terms of the effect we're having on activation, but largely on a very basic level, THC inhibits the transmission of a message from one neuron to another.
Thank you for that breakdown. And I think I got maybe 45% of it, which feels like a victory because this is so confusing and very few people understand it. And in fact, I mean, the conversation over the last several decades has been, hey, this is natural. It can't be that big of a deal. But we are finding the earlier you use, it can be a big deal. You also write this: the disruption in some cases may contribute to the development of adverse mental health conditions, increasing the chances of accelerating the onset of their development. Meaning it's not every time, maybe not even the majority, but the risk factor maybe goes up. Can we go through a few of those? I've read that psychosis has become more common.
Yeah, absolutely. So one of the
things... And you're working on antipsychosis things right now.
Absolutely. And my PhD, I was very much involved in the psychosis studies department at King's College London. And we really, as a department, have done an awful lot of work over the last 20 plus years in understanding what is that link between cannabis and cannabis use and psychosis. Now, there are very good arguments, and I think there needs to be some weight paid to them, around the idea that somebody may begin to use cannabis as a sort of self-soothing, self-medicating method to deal with perhaps symptomology that already exists. You know, we see that in terms of people who have, for instance, ADHD are more likely to use cannabis because it helps them to quieten their mind, and, you know, where they, you know, have an absence of control over their thought processes, they actually gain some relief from smoking something like cannabis. But from our evidence and from our research, I believe, and I think there's a good reason to say, that very high THC, very high potency cannabis, which is much more common now if we look at the percentages of THC available in cannabis, they are contributing to the risk of developing psychosis. Now, does that mean that everybody who smokes a joint is suddenly going to become psychotic? Not at all. There are, of course, many other components to the development of psychosis, which can include things like genetic risk, environmental risk, risks around, you know, your social group, your engagement with education and school. But we also know that very high levels of cannabis use is highly associated with the development of psychosis. Now, one of the ways that we were really able to work that out was by doing huge longitudinal studies, which we did across Europe, where we took people who had developed psychosis from a range of different cities and people who were using large amounts of cannabis from a range of different cities. And we did analysis to see, you know, where there could be kind of cause and effect between the cannabis and the psychosis. And one of the very clear things that came out were where very high potency cannabis was being used, so cannabis with very high THC levels, we saw that quite clearly correlating with the development of psychosis.
Can I give hard data on that? Here in the US, illegally confiscated cannabis, this comes from NIDA, Delta 9 THC, and we're going to get into the different forms of THC and CBD and CBG and a bunch of the things that you're working on, but Delta 9 THC, which is the one I think a lot of us know, it was 3.96% on average in 1995. It was 16.14% in 2022. So why does potency seem to matter? And also, why does it seem young men are at greater risk of developing these mental health disorders than young women?
Yeah, well, those are both really great questions. I mean, you're sort of quoting 16.9% THC content for cannabis these days, and you know that probably sounds a little more realistic given the capabilities of the agricultural crop, I suppose. But last time I was in the USA, and I'm very lucky to be able to come and visit quite often with my work. I'm often very interested to go, particularly when I'm in California or Colorado, into shops that can legally sell cannabis. That's not something that we're able to do in the UK. And
a lot of them sell it even if they're not supposed to be selling it, by the way, all over.
I know nothing about this. But I will often speak with the person who is running the shop about, what is the available cannabis there. And they are often quoting numbers like 30, 35, 40% THC availability in some of these. Now, I think a lot of that is hyperbole. I think it's quite difficult to imagine that you could get the crop to reach those levels without some kind of external addition of a cannabinoid. But what that means is that when you have forced all of the plant material to turn into THC, there's very little room for them to develop into other cannabinoids like CBD, CBG, CBN. And so you have this extremely high potency in terms of what we have available. Now, why is that? Well, people want more bang for their buck, right? It's THC that makes us feel high. It's THC that gives us those psychomimetic effects, those sort of symptoms of that are similar to psychosis.
What's a non-scientist way of saying that? The thing that makes you feel good?
Well, psychomimetic effects are things like, hearing voices or visions or paranoia or delusional thought patterns, things that we actually associate with psychosis. But they're also, as I say, the things that give us that buzz and that high feeling. So that is what people are searching for, because there is this sort of belief that, well, if you smoke it and if you look at the names of often, it makes me laugh, when you look at the names of a lot of these cannabis strains, it's sort of things like amnesia, and they are in themselves sort of trying to suggest that they're going to have these very high effects. And people who are growing it and selling it are obviously trying to get the highest amount of THC, because then the consumer or the average consumer perhaps can feel that when they consume the product. Whereas when you have other cannabinoids like CBD, you don't actually get an initial feeling from that. There's no initial high that takes place when we consume CBD. Now, to come to the component around why do we see this difference in males and females, well, there's a couple of different reasons for that. And I am quite interested in sex as a biological variable between the response we have to drugs and also the outcomes we have in terms of different health conditions. But we do know that there is a general increased risk for men to develop psychosis other than women up until the age of about 30, 35. Now, once women start going through perimenopause and menopause, and we lose some of the neuroprotective effects of estrogen, the psychosis risk for women actually becomes higher than men.
Oh, really? Wow.
Yeah, fun fact. But in terms of why we see this increase in males, it could be, as I say, because women have this high estrogen effect, which could be acting as a neuroprotective. But it could also, particularly in the context of cannabis use, because we know that young men are more likely to take part in risk-taking behaviors, including drug taking. We know that young men are more likely to consume cannabis at a younger age, and they're more likely to consume more cannabis than women. So there's a chance that this is also contributing to those risk factors.
And then, even I remember taking abnormal psych in undergrad, and our professor said, if you're going to use marijuana, this was 20 something years ago, she said, don't use it before you turn 25, men. And I thought, okay, well, I'm never doing that. But this study came out, and I think you were referencing that, they say between 21 and 30 years old for men, they determined, this is from NIDA, at least it was published there, 30% of schizophrenia cases among men in that age bracket that were preventable were directly attributable to cannabis use. So it seems like, is it oxen free after 25,
Yeah, well, I bet if you looked at that particular cohort, the age of onset of use would have been much younger.
Early.
So often it can take quite a number of years of cannabis use during the developmental period where you get the disruption of the pruning. And then perhaps when you're in your kind of 20s, and maybe you start having some adverse life events, being put under particular amounts of stress and things, that's when some of the disordered wiring, as it were, will start to become more apparent when you get these external stressors added.
So it's not like alcohol where you can immediately see, hey, you're going out 5 nights a week, you're not getting your work done, you're having a problem, that the effects of cannabis exposure early and often might show up later. It's delayed.
Yes, yeah, that's very possible. Although, as I say, and what we kind of seem to see in the literature, those who start using cannabis later, so, past the ages of 21, 25, whatever, we don't seem to see the permanency in the changes in our brain functioning and our brain structure. Whereas when you've started using in that younger age bracket, we're talking sort of 12, 13, 14, 15, 16, we don't know if we can ever really reverse those brain changes. Or I wouldn't say reverse because it's the way that you developed, but if we could ever improve on those brain changes. Whereas use in your mid to late 20s, we seem to see that there is some acute effect and some sort of moderate chronic effect, but with a sustained period of abstinence of more than a month or a few months from cannabis use, your brain functioning seems to go back to the way it was before you used cannabis.
I'm sure parents, have asked you, saying, my son's 16, drunk driving, very scary. Mm-hmm. I've heard that weed isn't that big of a deal. In fact, it's legalized in a lot of places. I'd rather him use that than alcohol. You understand this better than almost anybody. What do you advise them? What do you tell them?
Well, preferably neither. Preferably no alcohol or cannabis during adolescence, or really any kind of external drugs being added to the system, because, as I say, you're going through this very fine pruning. But one of the fun parts about adolescence is that we see this huge change in our appetite for risk taking. It's part of the parcel. It's part of the developmental period that you are much more likely to want to engage in drug taking and risky behavior and driving your car too fast. So all of these things become this kind of smelting pot for a risk period in adolescence, which can be extremely concerning for parents, I'm sure. But when we think about cannabis use, yes, okay, you're not getting so blackout drunk as you would when you are using alcohol, but that doesn't mean that you are not impaired, particularly in using sort of the skills that you need to drive a car, where you need fast reaction times. Now, what did I say about cannabis? It inhibits neuronal action, so you are less likely to be able to react to a car incident. Another really key part, and we often talk about the acute effects of cannabis and what it's doing on a mechanistic level in our brains, but because of what it's doing on a mechanistic level, our ability to learn decreases. Our ability to want to engage in sports and social engagements and educational engagements decreases. Now, those in themselves are risk factors. Lower high school attainment, lower levels of physical activity. These are also risk factors for developing mental health disorders. So it's not just about the acute moment of being safe. Cannabis is an addictive drug. I often see people say, oh, it's not addictive. It is. Cannabis use disorder is real. We really know that the way cannabis works in the brain, it very much is having a dopamine spike on some regard, which is the primary mechanism for any addiction. And we know that it really engages areas of the reward circuitry within our brains. So it may even be priming our brains to be more addictive to other things because of this combination of activation within the reward circuitry.
Grace, I can hear 5 million millennial heads explode to hear, one, weed could be addictive or cannabis could be addictive, and two, it's kind of Nancy Reagan, this could be a gateway, but you're saying, no, the science is actually bearing that out at this point.
Yeah, absolutely. And some of the studies that I was doing during my PhD, we were taking cannabis users who had been chronic users for a long time, who had started their use during adolescence, and we got them to do various tasks where we looked using fMRI machine, functional magnetic resonance imaging machine, and we saw that they had very different activation patterns within their salience networks and their reward networks to the tasks that we were showing them, that to us identified that they had a different activation within that reward circuitry as a result of their cannabis use. Now, that was a small sample size that we took. Obviously, there's many other mitigating factors that can be included in there. And I completely agree that if you smoke cannabis every day or you drink a bottle of wine every day, if you drink the bottle of wine every day, you are almost guaranteed to have a health condition that will come about from that. You are not guaranteed with the cannabis because there is a big genetic part. I am also very well aware that, alcohol leads to much higher rates of things like aggression, whereas with cannabis, it's quite unlikely you see two stoners fighting on a street corner, right? So there's definitely arguments of why cannabis could be better than alcohol. But for the purpose of this conversation, talking about adolescence and adolescent brains, I think both of them have a significant risk. And why should you take either risk?
I want to talk about two social facets before we get on to the alternatives, which you're exploring, which I think a lot of people are wondering, okay, if not this and not this, then what, perhaps? First of all, I know that you're caveating some of this a little bit with causality and directionality because all of that hasn't been exactly solved. But the NIH does point out, if someone begins using early, on average, lower educational attainment, lower employment numbers, lower earnings. I could see someone saying, well, yeah, this is neurobiological or this is sociological. We know boys are more likely to do this. Lower income, perhaps. Hispanic and Black boys more likely, according to government numbers. So how do you make sense of the social element?
Yeah, well, I think that is, as I say, a huge part of the picture. Obviously, there's a certain level of culture around this, and you are more likely to use a drug if your peers around you are using a drug. Speaking from a position in the UK, we see much higher rates of cannabis use amongst young Black men in London than anywhere else in the country, for instance. Now, why is that? That's because as people are growing up there, the people around them are using it. Maybe their parents or their friends or the people that they admire are using it. Obviously, we see it in particular cultures within music and things. And when people find themselves associated with that, we all want to be part of some community. And things like cannabis do have a very large culture and a very large community that people do want to join. But there is another aspect to it. When we think about drug use and what we are actually doing, we are soothing ourselves in some way against whatever is happening around us. And often when people come from low socioeconomic backgrounds, or they've had particular exposure to traumas in their childhood, or they have some kind of predisposition for certain mental health disorders or neurodivergence, using cannabis is a soothing thing to do. it removes them somewhat from their environment. One of the key symptoms, symptoms is the wrong word, one of the key things that happens as a result of cannabis use is we have much higher rates of dissociation. So not being fully present with the environment around us. Now, why
you get
would
to
you
escape.
not? Exactly. Why would you want to not be present? Because you want to somehow escape from the environment around you. Now, that could be because you're sitting around and you're very bored. It could be because you're in a really terrible environment that you don't really want to engage with. There could be a whole number of different reasons that contribute.
I see. And again, to the broader conversation, I also wanted to read this from something you wrote. There is a need for caution when considering the therapeutic potential of cannabis for adolescents, and particularly in public discourse leading to potential trivialization of possible harm from cannabis use in adolescence. Where do you think the conversation needs to go? Because you're looking at some therapeutic methods, which we'll jump into next, but conversationally, how should we be talking about cannabis?
Yeah, absolutely. Well, I think we need to take it very seriously. You know, people say, oh, it's natural and it doesn't do any harm. Well, you know what else is natural? The poppy. You know what comes from poppy? Opioids. You know, we wouldn't take them any less seriously than we need to, right? Just because there's a lot of things out there in the woods that will kill you. Just because it grows in nature does not mean that it is safe. So,
True.
you know, that is a myth that we need to dispel, number one. But what I really meant by that, by the trivialization, and that paper came out in 2020, you know, it was really watching a lot of what was happening in the United States, particularly when we saw states moving from legalization of medicinal cannabis to just allowing legalization of cannabis for recreational use, full stop. People sometimes think, oh, well, that means there's no harm then. That means if the government has allowed this, there must be nothing wrong. Now, that is not true. That's absolutely not true. Now, we know there are medical benefits to cannabinoids. You know, we know THC, for instance, actually could be extremely useful and is, in fact, available as a licensed medicine for people with symptoms of multiple sclerosis, for instance. We also know it could be very useful for Parkinson's tremors. We know it could be very useful for increasing appetite in people with eating disorders. There are very, very good applications for which that is used, as there are for many other drugs that are licensed. But that doesn't mean that there are no side effects. There are always side effects with every drug that we take. And when we allowed cannabis to move from just a medicinal product to a recreational product, I think there was a misinterpretation that, well, this is a completely benign substance in terms of adverse effect, which is just not true.
A lot of people thought that, for sure. Okay, so if we're looking at alternatives, some people might know, what is it, Delta 8 THC, I think, and there's the spice and there's the K2.
I mean,
Do you want to say anything about those?
Yeah, absolutely. I think that these are potentially more dangerous than Delta 9 THC. And the reason for that is we do not have the data and the evidence. One of the good things about cannabis use going on in the way that it has for potentially millennia is that we have a lot of good data about what are those adverse effects. We also, you know, from studies like what we've been doing at King's College and at various other institutions for the last 60 years, have defined what these different cannabinoids are, and no cannabinoid has been researched more than Delta 9 THC. So, you know, better the devil you know, right? We know what that drug looks like. When we start talking about things like Delta 8, there's, you know, still not a very clear understanding about all of its mechanisms, but particularly things like spice, which is a synthetic cannabinoid. We do not understand what the effects are when that cannabinoid binds to the cannabinoid receptor. You know, the affinity it binds with is going to be much different from that of a naturally driven Delta 9 THC. And that could be extremely dangerous. And that's why we see these very profound effects when people use synthetic cannabinoids.
So is a good rule of thumb, if you can get it at the gas station, don't take it?
I mean, personally, I try not to consume anything I've bought in a gas station, but you know that's just me. But you know, where it feels like people are trying to find loopholes around the system. You know, I was in Austin, Texas quite recently, and somebody was trying to explain to me the cannabis laws there, because it seemed like cannabis was being sold everywhere, and yet, from my understanding, it was illegal. But actually, if it's Delta 8 and it's this and it's that and it goes, the moment you start
if you gift it.
Potentially. Yep. But wherever we are starting to meddle with the molecule in order to get around the law, well, that's when you're potentially making it even more unsafe, because we do not have the data, because you know, it's obviously not under the lens of the regulator for a reason, which is why it's legal, or legal, you know, it's not illegal. And just because something is not illegal doesn't mean it's safe.
Got it. And so you and some scientists here in the US are trying to do some more rigorous inspection and evaluation of alternatives to THC, right? Or the Delta 9. I don't know if I have all my terminology correct. This is not my thing. I prefer wine. But you're looking at some alternatives. What is that?
Yeah, absolutely. So, as I said, there are plenty of things out there in nature that will kill you, but if you look close enough, you'll normally find something next to it that will save you. And there is no difference in the cannabis plant. So I told you that THC, Delta 9 THC, is one of the up to 150 plus cannabinoids that we have now isolated and know about. Now, all of those different cannabinoids have slightly different shapes, and they do slightly different things when they bind in the body. And the most prominent secondary cannabinoid in the cannabis plant is cannabidiol, or more commonly known as CBD. Now, CBD is, as I say, the second most prominent available cannabinoid. And we did some work at King's College quite a number of years ago now, where we wanted to see what was the acute effect of THC, but we also wanted to see what was the acute effect of CBD. And what we saw was an almost opposite effect of CBD, where it appeared in further studies looking at different combinations of THC and CBD and how that affected the brain. It appeared that CBD actually reduced those psychomimetic effects, those psychosis-like symptoms, and actually acted as a neuroprotective against what could be harmful damage done to neuronal tissues by THC. Having CBD there present actually protected neuronal tissue, which led some clinicians and some scientists to think, well, that's very interesting. What if we gave CBD to people who had psychosis-like symptoms? And they did. And what we found was actually very high levels of CBD acted as an antipsychotic. So what we have been doing, myself as the Chief Scientific Officer of NWPharma Tech, along with some really amazing researchers based in the US, based at Yale University, who have been working in adolescent populations who come under what we would call a definition of high risk for developing psychosis. So this is before someone has had a first episode of psychosis. There are symptoms that they start to develop, and we are now working, we've done some preliminary data, we've got some really good efficacy signals, and we're about to now start clinical trials using very high potency CBD, so kind of much higher than you can buy from your local health food shop. And we are going to start those trials hopefully soon to see if we give give CBD to these clinically high risk of psychosis patients, whether we will A, reduce their symptoms, but B, potentially reduce the chance that they will then transition into a psychotic state.
What are some of those symptoms, by the way?
So for psychosis, a lot of those symptoms can be kind of quite clear in terms of hallucinations, in terms of hearing voices, seeing visions. Quite often, though, they are more based around thought patterns, delusional thought patterns. So things like thinking that people
Paranoia.
might be out to get you. Yeah, paranoia in some way. Or even grandiose feelings. So starting to think that you may be the Messiah. These kind of
Like
things.
schizoid, you heard, I remember the schizoid type things. Is that?
I'm not sure I know the reference, sorry.
I don't know. I remember schizotypal personality disorder. I don't even know.
Schizotypal. Yeah. So,
Yeah.
yes, absolutely. Yeah, absolutely. Now, that's when you have a full-blown psychotic episode, and we say
So you're
that
trying to
somebody
get
is in psychosis. Yeah. But there is actually this phase, this prodromal phase, as we would call it, where we start to see these symptoms come. Now, maybe somebody is not hearing a voice, but they start to hear a noise. Maybe they were very, very social, but now they're starting to think, you know what, I think that guy just looked at me strange. Maybe they were normally quite sort of easygoing, but they're starting to get feelings of anxiety. Now, this is very, for people who go on to develop psychosis, this is very likely to start occurring during this adolescent period. And often these people don't really understand what's going on. It doesn't really fit neatly. You know, it's not depression, it's not anxiety. You know, it's quite unclear of exactly how to define this group. And that's something that the amazing scientists I'm working with at the moment have really spent the last 30 years doing, is how do we define this group? How can we really capture them in this early stage? And then the next question, which is what we are working on now, is what can we do to try and mitigate that? Now, up until this point, the answer has been things like cognitive behavioral therapy and altering people's behaviors. So, for instance, if they are very heavy cannabis users, trying to get them to stop using cannabis.
Right.
But there is obviously a limitation to how useful those interventions can be. Now, unfortunately, what does happen is often these people get put onto traditional antipsychotic medication without,
I was going to ask.
Yeah, without ever actually having been fully psychotic. Now, that is not good clinical practice. Antipsychotics, as I say, pretty much all drugs, have some kind of side effects. Antipsychotics have very serious side effects. A lot of them are metabolic. So you get a lot of people who start to put on a lot of weight, potentially start developing things like prediabetes. You get things like interruption with sexual functioning and sort of desire-driven behaviors. And furthermore, you actually affect the neuronal tissue, so you reduce how plastic it is, how much your brain is able to adapt and learn with your environment. And so you really cause a huge amount of sort of stunting within the person that you're giving that antipsychotic to. Now, if I was to tell you, if I gave you a diagnosis of clinical high risk of psychosis, you had a 1 in 3 chance that you would develop psychosis, well, how much would you want to take on those side effects now, knowing it was not a certainty? Yeah, so that's where we're very, very excited about this particular clinical program, because we seem to have in cannabidiol something that can really go in there and mitigate the development of psychosis potentially without having this huge side effect profile that could be quite long lasting.
I was going to ask about any potential drawbacks, because one side effect of these traditional antipsychotics you didn't mention are that people feel like zombies. They don't feel like themselves, and they just say, I'm tired of walking around in a fog. If you're saying CBD can be protective in some ways, any concerns about drawbacks? Because, I mean, I've seen CBD and thought, hey, you know, maybe that would help you relax or whatever, but I'm scared. You know, anytime we don't know what something is, I'm scared.
Yeah.
Any concerns?
Well, compared to the majority of psychiatric medications out there, it's got to be one of the safest. We know that you can't overdose on it. We know that it's non-addictive. And we know that it is not having these negative effects on our metabolic systems, and it's not reducing things like neuroplasticity. We know that CBD has been used in, nutraceuticals, in kind of health food additives by thousands, if not millions of people by now. And the adverse effects from that seem to be very, very minimal. We know that CBD has been licensed for the treatment of a certain form of treatment-resistant epilepsy, and that's been licensed and used in young children since 2018, and the effects of that in a drug called Epidiolex. And we know that the effects of that are now pretty well characterized. Now, there is one thing that does seem to be something that needs to be monitored, and that is an effect on our liver and on liver enzymes. Now, in your average healthy person, that wouldn't be too much of an issue. But where you have someone who may already have some kind of issue with their liver enzymes, or you have somebody who's taking very high amounts of other medication, often as people who have epilepsy, for instance, you are reducing the ability for the liver to properly get rid of those other drugs. And so you do need to monitor people in terms of the potential increased toxic load to the liver when using very high levels of CBD. But that's not to say that it is going to cause any kind of liver damage in your average healthy person. And actually, in terms of its net benefit from a psychiatric position compared to other drugs, I think it would be far, far more beneficial.
I notice you keep underscoring that, because it's not just a flawed possibility or something that is perfect, because nothing out there is going to be perfect. So you're really trying to always do this balancing and ROI in essence.
Yeah, absolutely.
Right? Okay.
Yeah.
Any other alternatives that I think you said there are 150 different elements, active elements in this plant. And I don't know if there are any other out there as well that you're looking at that you think might have beneficial therapeutic effects, or just might be benign. A lot of people, they're not looking to improve their mental health. They're looking to just feel good for a moment, but not wreck their future mental health.
Yeah, absolutely. And as I say, we have CBD, but we also now have really good evidence around things like CBG and CBN. Now, they are, as I say, two of the more of the 150 cannabinoids that exist. And as you say, when you've got that many different compounds, and these are only in very small amounts in the cannabis plant, and most of the time when we're smoking cannabis, we're not getting a full panel of all the different cannabinoids in it, which is why studying this stuff is so hard. You mentioned before that you like wine. Now, right, if you go and buy a bottle of Chateau Chalon from 2018, and you buy one from 2019, it's going to be a different bottle, right? Because the sun was different, the rain was different. Now, if you go and buy a Chateau Lagrange, it's going to be completely different because the soil was different and the grape was different. And the same exists in cannabis. There are all, it's a natural product. The soil, the genes of the plant, the sunlight, when it was harvested, all of these things are going to adjust the profile of the plant. And we're talking just about cannabinoids now. We haven't even spoken about terpenes, about flavonoids, other components that make up that plant and what it does. Now, we know that, flavonoids are what, gives it its kind of, its taste and its smell. Terpenes also, but we know with terpenes, they are having some effect on how particular receptors work. We know that from, things like studies of, certain different terpenes and how they affect memory performance, for instance, or increasing our likelihood for sleep. Lavender.
Is that just a chemical in there? Terpene?
Terpenes, yeah. So it's a name of the types of chemicals. So
okay,
when we think about going to a cannabis shop and buying a particular strain of cannabis for whatever we use, of course, we want to take into account the cannabinoid profile, but we're also going to take into account the terpene profile. Though having said all of that, the evidence for how much those things have an effect are largely at this point in time due to enthusiasts who, like the monks in Burgundy, writing down what the effect of that particular plant was and interpreting it in a way that is not particularly scientific. Now, in order for us to actually examine these different compounds and how their combination together has a certain effect, we need to have a standard product. We need to have a standard combination of cannabinoids and terpenes with which to test. Yeah. Now, that is very difficult with a cannabis plant, and it's certainly not what you want if you are engaging in a more recreational use of the product, where you kind of want more of a sort of farmer's market-esque feel. You go and someone has grown something, rather than going to someone who has produced something in a lab where it is particularly been kind of constructed, made of a certain sort of style of cannabinoids. Now, that is a huge problem in the eyes of the FDA, because how on earth can they standardize what would then be seen as a drug? So we have, cannabinoids that we have isolated, like THC, like CBD, now a lot more work on these others, CBG and CBN, to see what is their individual mechanisms. And we know with CBG and CBN, it could be that they are better for things like inducing sleep. So in terms of use for insomnia. But there are other kind of labs. There's a fabulous lab in Israel that I'm always completely amazed by, who has isolated the 150 odd cannabinoids and has been testing the rarer ones in interesting combinations on particular cancer cell lines to try and see if there are particular cannabinoids that would be better at treating certain cancers. Now, this is very difficult to get out of the lab and into a pharmacy, because how do you kind of bridge that gap to do the big enough clinical trials using a standardized product to test a standardized outcome?
You have got your work cut out for you, but I am happy that there are geniuses like you out there doing this work. A lot of people probably hear what you said and think of cannabis or delta-9 THC a little bit differently, think of CBD a little bit differently. If they want to read more about what you're doing and working on, where can we find it? Yeah,
sure. So obviously the work that I'm doing in the cannabinoids is largely based from NWPharma Tech. You can kind of visit what we're doing there and see about the clinical trials that we have coming up. As I say, a lot of the work, if you're really interested in that link between cannabis and psychosis, King's College London, we've been working on it for a long, long time, and we've got an awful lot of publications that really have tried to engage with the cannabis community and not just kind of tar it all as sort of drugs are bad, because I don't believe drugs are bad. I think that, everything in its right place, right? So yeah, please go and check out the work that we've been doing at King's.
Yeah, Google Scholar, Grace Blest-Hopley. You're going to be scrolling for a bit, but read it. Super interesting. Yeah. Grace, thank you so much.
That's wonderful. Thank you so much for allowing me this chance to come and speak about my work.
Many of the warning signs when it comes to adolescent boys and early cannabis use seem like they are flashing red, right? But there are still questions. So after decades of hearing, it's natural, it's harmless, it's weed, what's your instinct when it comes to the level of risk in young men? Did this conversation make you rethink any of that? Let me know in the comments. I would love to hear your thoughts on this. Please like and subscribe to All Boy. We are on YouTube, Apple, Spotify, Substack. The website is allboyallgood.com. I'm Chance Seales. See you soon.